Hey everyone, Dr. Alex Ritza here. Today, if you have scoliosis or you've got a kid with scoliosis, this video is to help you. In 6 years of doing videos, I haven't done a scoliosis video. And usually because there's not that much different to manage in a scoliosis case than a case where somebody has a spine problem. But I keep hearing in the office from a lot of patients ideas and beliefs that have been brought about by Instagram or social media or other health practitioners that are just simply wrong. So I wanted to do a video to help clarify management of a case of scoliosis. And hopefully this video is helpful for you if you need some more info that is accurate, that's scientific, and that does not reek of bull. So I think the best way to start this video, I was taking care of a young woman. She's around 23 years old, initially came to see me because she had a bad episode with another chiropractor where there was a sprain or a strain in one of the joints of the spine. They initially started seeing her to treat her scoliosis, which was around, let's call it 20 to 25 degrees. It was on the upper end, but she was skeletally mature. So we know that for the most part, it wasn't going to worsen, or it wasn't going to worsen because of bone development. Management, making sure it doesn't worsen, that's a different story, but it wasn't going to worsen because, or too bad, because she was that skeletal maturity. Anywho, so with her case, we talked about a few things. We talked about, especially if you're over 20, 25 and you're watching this video, your scoliosis is not going to get worse because the bones of the spine continue to grow in a greater angle of scoliosis. It might worsen by a few degrees here and there because of like a functional scoliosis or a more imbalance is created. But for the most part, that number at that point in your life is going to stay at around that number. So in this young woman's case, what we talked about was that, we don't do any like asymmetrical exercises. We don't like treat the scoliosis in a particular way. What you do is just like with every other patient, you make the spine healthy again. So if you have joints that are not healthy, you correct them or adjust them, get them moving properly. If you have nerves and muscles that aren't working well, then you acupuncture them, you rehab them, you stretch them. And it's the exact same management process on my end. And the management process is not to ever get rid of the scoliosis. It's to make sure you make the spine healthy again. And if you make the spine healthy again, 99 times out of 100, somebody's pain is going to go away. And so that brings up another point. If you've been told that your scoliosis is the cause of your pain, frankly, in most cases, that's garbage. I'm looking at some notes I have from chiropractic school. And so let's say that you're a younger person in puberty, and you've got a curve that's like 20 to 30 degrees. Now, in this point, this is where you want to observe and be x-raying around every 6 months to make sure that there's not a lot of progression and then it's not worsening. Because when you start getting north of 30 degrees, that's when you can have some more risk of progression and definitely some more impairments with like more pain, reduced quality of life, change in function, and trouble doing stuff in your daily life. So if the curve is north of 30 degrees, that's where maybe the researchers think that some pain might come as a direct consequence. But the way I explain it to patients is and we rarely see curves that high in the office, as long as you don't have a curve that's high, what can happen is if you have scoliosis, you'll get some asymmetry in the way the spine works. Because if you have a curve, the muscles are going to function quite different on either sides. And one thing we see a lot is that on the outside or the convex part of the curve, where the rib joints, they get kind of bunched up. And we'll notice that where the rib joints on the outside or the convex part of the curve, when they get really bunched up, we see that those rib joints become really dysfunctional. And we typically in the office will see more problems on the outside of the curve because it's almost like those joints are being buttressed, or that they're just typically more stressed. The spine is stiffer when trying to move it from that side, and you'll get some asymmetry in the way that the body functions. And sometimes that asymmetry can lead somebody to have a less healthy spine on that curve or that side of the curve, or in general. And typically, if it's less healthy and doesn't function as well, that's when you can start having pain and dysfunction. So just to kind of summarize that latter point, with scoliosis, we do see asymmetry in function. We do see from the asymmetry in the anatomy, and we can see typically more problems on the convex or the outside part of the curve, but it isn't always universal. I started taking care of a guy recently, or a young gentleman who played pro tennis, and we found that he has around a 10-degree scoliosis, but all of his problems are on the concave side of the curve. So it's not cause and effect, and that's why anybody that says scoliosis causes pain, it's just simply not true. It's not backed up by the research, at least if we're talking about curves less than 30 degrees. So if you have a scoliosis, what you should be thinking about is, just like everyone else should be thinking about, make sure that your spine is healthy. And if you don't know if it's healthy or not, make sure you get it checked by a chiropractor. And if you're younger, like if you're in your pubescent years, then that's where you should probably first make sure that you also check in with your physician so that they are on top of it, sending you for x-rays, and that you can get a referral to an orthopod or an orthopedic surgeon so that you always have that consult available if it ever needs to progress to that level, which is super, super rare. Number-wise, I'm looking, at least from when I went to school, is 0.1 to 0.3% for surgery. Very, very, very rare. So if you got scoliosis, doesn't cause pain necessarily. It can create some asymmetry. If you're young, you want to have it managed with your physician and a good chiropractor, if you can find one in your area, to make sure that you are observing it and keeping the spine healthy. And if you are like the patients that I take care of that are typically north of 25 years old, it's important that you focus on the spine as a whole. Don't be doing any asymmetrical exercises. Treat the spine symmetrically. Do all your exercises on both sides and your stretches on both sides, with maybe more work spent on one side or the other. If you notice more pain, discomfort, tightness, then focus on that. But don't always just like stretch more of the outside because it's the outside. So I hope that video, guys, was helpful. Hope it wasn't too rambling. I hope that you now know that scoliosis doesn't necessarily cause pain, and that you just want to treat it like every other spine for the most part. Make sure that it's healthy, make sure it's mobile, make sure that there's good core strength, make sure that it's stable. And then if you do need to see somebody for a problem, it's more on their end to manage some of the intricacies of that asymmetry. But I think for the most part, for you guys, focus on keeping it healthy, moving it, use some of the resources we have to keep your spine healthy, like say our Move curriculum, which I will make sure is linked in the comments below. And by that, I mean the description. You guys take care. Have a great day. If you have any questions, please be sure to leave them below. And be careful out there on the YouTubes, because sometimes stuff's not so good. Take care, guys.